This conference will now be recorded.
Okay, thank you. Thank you. Sorry about that. I was on mute. I have to mute on my phone and on my screen, and I only had one turned off. So let me start over. Good morning. I would like to welcome everybody to our lobby hour this morning. My name is Kristen Jimison. I am VNA's Director of Engagement, and I have with me today Janet Wall, who is VNA's Chief Executive Officer, and we are going to take you through what's going on at the General Assembly. We're going to talk first about Nursing Public Policy Platform, and then we are going to talk about different ways you can advocate for nursing. And if you could do me a favor and mute yourself so that we don't get feedback, that would be terrific. While Janet gets started, can you all do me a favor, and if you can access our chat feed, let us know where you're from today, because I know we've got students from Longwood, we've got students from George Washington, from VCU, and we have a lot of practicing nurses out there. So we'd love to know where in Virginia you are from. And Janet, while we do that, you can go ahead and get started.
Good morning, everyone. Great to see you all here. This is quite a crowd. Did you want to flip to the next slide? Great, thank you, Kristen. So just a little background. In recent years, we developed what is now called the Virginia Legislative Nursing Alliance. And it's composed of leaders from nursing organizations throughout the Commonwealth. And I'm excited to say that this year we've had even greater participation than we have in prior years. It continues to grow in both engagement and the number of players. As you can see on the screen, we've got quite a few. And the purpose of the group is twofold. It's a great way for us to have a better understanding of what all of the other organizations, nursing organizations in the state are doing, what their priorities are, and they can understand what ours are. And then it also helps us to identify 4 to 6 priorities that will be included on the annual Nursing's Public Policy Platform, which is what we're going to talk about today. So let's take a look at the 2020, well, actually it's now the 2021. We've had to do this a couple times this year because of course we had a special summer session that in fact was longer than our General Assembly session, I think, is going to be. But let's take a look at this. So the first issue that I wanted to chat with you about is funding the Virginia Preceptor Incentive Program. So the great news is that this was legislation that we had effectively or successfully gotten passed by the legislature in the 2020 legislative session, but it hit. So as just a little bit of background, what we know is that our higher ed system has more students in the pipeline who wish to become APRNs than it has hands-on clinical instructors or preceptors. So now more than ever, we need to get those APRNs in the workplace to help tackle the shortages in fields like psychiatric care and primary care. And we think that we can, well, we know, we've surveyed all of the universities, and we know that we can significantly increase enrollment if we have this kind of funding incentive in place for the preceptors. And it could be APRNs who would be preceptors. It could also be physician assistants. So we got it passed in the 2020 session. That was great, but then COVID came along and reared its ugly head. And as you, I'm sure, are aware, most programs lost funding as the state tried to tackle all the funding issues related to COVID. So now we are focused on getting the funding for that. And Kristen, if you want to share any updates on that. Kristen, you might be on mute.
I have to keep reminding myself I have to unmute in 2 places this morning. I'm sorry. So those budget amendments have been submitted, and they will be going through the same process, but I believe that we don't anticipate a lot of opposition to them this year. It's just going to be a question of what the final budget looks like.
Thanks. And this is huge. And by the way, the legislation that was passed called for $500,000 in each of 2 years. So this can be something that goes a long way in addressing the issue of lack of preceptors and not enough spaces for students in the APRN programs because of lack of preceptors. So we're very excited about this. And the next one is another one that boy, this is so important, and we're really making some great strides here that Kristen will talk about in terms of what's happening currently at the legislature. But currently, those people who are working on COVID frontlines do not have assurances of workers' compensation if they should contract the virus. So nurses working on the front lines aren't able to, they don't have those assurances that they're going to be able to get workers' comp if they have COVID. What we're working on is to make sure that some assurances are in place. We rely on, all of us rely on these healthcare professionals, and we need to take care of all of you. So, and I know there have been some great stories from nurses that Kristen has talked with. Well, I should say great as an impactful, but also heart-wrenching. One I'll just share with you, and I know this was shared in testimony, and then Kristen can share the update with you. I believe this is in a subcommittee now, but she'll be able to share the update. But if I can just read this to you very quickly, it says, I am a registered nurse who personally contracted COVID-19 after working hard this year serving COVID-positive patients in Virginia. Being a nurse during this pandemic, whoops, let me scroll over here a little bit, has been very challenging. While others stayed safely at home, I left to work in a hospital full of uncertainty and fear. I embraced change as new instructions were issued daily, sometimes hourly. As guards escorted deliveries of masks and patients weren't allowed to see their loved ones, it often felt more like a war zone than a hospital. I stood in line every day, grateful to be issued sparse personal protective equipment. I volunteered to trade places with older colleagues who were assigned to COVID-19 patients to protect them from the virus. When masks to the public became scarce, I used my evenings and weekends to sew hundreds of masks to give to patients, coworkers, and my community. My job put myself and my loved ones at risk. I moved out of my town home to protect my sister from my potential exposure. I refrained from kissing my fiance for months, fearful of unknowingly passing the virus to him. But I kept showing up to work day after day to help my patients and my community. She goes on to say, finally, when I did contract the virus, I was terrified that I had spread it to someone I love. Now, more than a month later, and this was several months ago, I am still fighting pneumonia and other serious complications related to COVID-19. I have medical bills piling up and no idea when I will physically be strong enough to return to work. Workers' compensation would cover my medical expenses and lost wages. Yet under the current laws, I cannot claim it without proving a direct link to a specific positive patient. And that's the issue. We, and the concern on the part of hospitals has been that individuals might claim that they've contracted COVID at the work setting, but it's been contracted elsewhere. The reality is we know that the vast majority are contracting it at the workplace, but it's very hard to prove. So this takes the burden off of the nurse to a great extent. So I think we've made some great progress on this. We've negotiated some language. I believe it would start at the onset of the first executive order, March 12, and would include, I think, with the second executive order, or when the governor concludes the executive order. But Kristen, do you have some information you'd like to add to that?
So yes, I do have some updates, and what you all can see on your screen now is something I'm going to show everybody how to use a little bit later, but you can go online and get the status of different bills and legislation. And so this legislation, we did work with some other healthcare associations to propose some amendments to it. And one of the things that Janet mentioned was that one of the amendments was that it originally, you can see that this was retroactive to January 1st, 2020, but we made this retroactive to the start of the first executive order, which I think was March 12th or 13th.
Yeah. And
also include a date for this to sunset, which I think is the end of 2021. So this is something that will not be a permanent presumption, but will be a presumption while the pandemic is going on. So this was heard in the House Labor and Commerce Subcommittee number 1 on the 14th. It was sent to that committee. On the 19th, they recommended reporting it out with a substitute. So that means that the subcommittee of the House Commerce and Labor Subcommittee accepted the amendments, agreed that they were great or workable, and voted to pass it to the larger committee for more debate and discussion, and then they'll vote on it again. A couple of things I saw, a couple of questions related to the vaccine. This particular presumption and other occupational health presumptions, if there is a vaccine available that is either mandated to you by your employer or offered to you just in general, so if once you have the ability to get the vaccine, if you either refuse to take it or waive your right to take it without a documented reason from a physician, the presumption would not apply to you. And so that is I got a couple questions I saw in the chat about that. So if you are offered the vaccine and don't get this, and then if you're offered the vaccine, don't take it, and then you get COVID at the workplace, you cannot assume there's a presumption of workers' comp. So,
but of course, if you do have a medical condition, as Kristen mentioned, that a physician signs off on, that is your reason for not being able to get the vaccine, that's different. But otherwise, you would be expected to get the vaccine if it's offered to you.
Right, and that is not specific to this. That is just that's in the workers' compensation code and regulations for any presumption that if there's a vaccine available for something and you don't get it and you have no reason to, that's not medical, you don't get the presumption applied. So we will be letting everybody know the status of this. It's moving along. We're not quite sure what's going to happen, but we've done a lot of work. The VNA, our government relations commissioner, and Janet and some of our other members have really worked hard to get this to a place where there's a good consensus around it, because we heard all summer and we're still hearing, and I don't anticipate it ending, that nurses are, they've gotten sick and they're sick for a long time. And a lot of them, it's not just, 1 or 2 weeks. Some folks are sick for months on end, and they really need some financial compensation because they've been asked to do all of these things and be called heroes. And so we're trying to make sure that the ones who do treat COVID patients and get the virus at work and become a medium or a long hauler have some compensation and help us with all of that stuff. So
yeah, and I'm sure the testimony I'm sure the testimony I read is very familiar to all of you, a very familiar story to all of you, whether it's impacted you in that way personally or someone, I'm sure. So we want to try to address those cases.
Yeah.
But seem to have a lot of support right now, so we're excited. The next piece is reducing unnecessary practice restrictions, and one of these focuses on the transition for nurse practitioners. So if you recall, just as a little background, we, working with VCNP, were able to get legislation passed, a couple years ago now, a few years ago maybe, for a 5-year transition to practice. That's exciting, but that's the low end of the bar because most states have a much more liberal legislation in place or regulations in place for at least a 2-year transition. So that's what we're shooting for. The good news is that the governor, in one of these unnecessary practice restrictions, decided to issue an executive order reducing the transition to practice for nurse practitioners from 5 years to 2 years. But of course, an executive order is temporary. So he recently extended his executive order, or he extended this until the executive order ends. That's great news, but what we want to see is this language codified so that the time span is permanently reduced to a 2-year transition to practice. And we think that although no one wanted COVID to come along, in this case, we think we'll have some positive results because we can illustrate that the quality of care that has been provided has been excellent. And of course, we're not doing this just because of COVID, but it certainly provides a good testing ground for it. And Kristen, anything on that?
So, I don't have updates yet on where that stands. I do know that, as usual, there's a hot debate on that topic between the nursing community and physicians, just because there's some push and pull there always. But we're trying to work on on that. The big fight was what Janet talked about a number of years ago when we moved from, no path to a 5-year path. And so our hope is that if we are asking, APRNs, nurse practitioners, to work in a pandemic and saying, okay, well, in this situation, it's good for you to have 2 years. It should be applicable during a regular non-pandemic time as well. So we'll keep everyone updated on that. But I think that's coming up for committee to tomorrow or maybe early next week. I don't know off the top of my head. I haven't gotten an update, but we'll let everybody know.
Yeah, and I think there's an increasing understanding that this is what nurse practitioners are trained to do. This is their education. And so they should be able to practice to top of practice or top of education. So, to most of us, this seems like a no-brainer. And we just need to continue to work to get that message across to the legislature. Another waiver included the language for removal of a requirement for nurse midwives to maintain a consultation agreement and with a physician. And again, this is just an unnecessary requirement. It doesn't have any impact on patient safety, and in fact could impede access to maternal health care in rural and other underserved areas. So we want to nix this permanently. Okay, and another one that is making some progress, but I will share with you that the bottom line financials are the real struggle for this. But I think, again, this is not something that is specific to COVID, but because of COVID, we have the ear of legislators perhaps a little bit more than we have in the past. So what our goal is to have a registered nurse in every public school. And this is not the first time that we have focused on this. In fact, it was deferred most recently in the summer session due to the fiscal impact. But many legislators had expressed an interest in looking at this issue more seriously, and that's what we're doing now. We know that during COVID-19, it's the registered nurse and their skills in assessing, triaging, isolating, and contact tracing who can make the difference in keeping our schools safe and healthy. But we also know that even in non-COVID times, the registered nurse in the school is often the only healthcare liaison or healthcare provider for these students in very rural or underserved areas. So it's essential not just during these times, and this is what we're underscoring, but during all times to have a registered nurse in every public school. Again, you can imagine the financial impact, and that's what they're trying to tackle right now. And Kristen, did you want to update? And this is in subcommittee, I believe.
So this was referred to finance and appropriations, and it may have gotten moved out, but it's not updated here on the system. But we are hoping that at the very least that comes out of this is a group to study it and to see how it can be achieved. Some of the feedback that we get, and it's understandable, is that it's hard for the state to come in at the state level and then mandate how localities spend their funds. Because they're not all the same. They don't have the same needs. Some of them have trouble finding an RN in a school because there just isn't the population of workers, the workforce to pull from. But this has come up, I think, Janet, every year that I've been at VNA, just about. It's something about school nurses. But this year, we really, all of a sudden, people started to see the need for a nurse in a school, because if you're a parent out there, you know that part of every school's reopening plan involves a school nurse or someone that fills that role. And so to get the schools open, it's really become a hot topic. And I did want to let everyone know we are going to talk about this a little bit later, but once the bills are looked at and studied, there'll be they show up here called a fiscal impact statement. And we looked at these last year. It's not up here yet, but you can download it and read all of the different impacts that the bill would have on counties and states and the state budget. So you are able to see that, and it sometimes can be pretty significant. We saw that in special session with our workers' compensation bill. That was a lot larger. That covered bigger populations. Some counties and cities, it was a $5 million impact. So you really can see on this page the cost of everything. But we're still going to work on it. We're hoping that we get, at the very least, a work group to study it and work on it for next year.
Yeah. And in the past, one of the roadblocks has been that the counties wanted to maintain their autonomy in deciding how to manage their staffing. Excuse me, I'm trying not to sneeze. And and whether or not they had school nurses or how they managed all of that. But would certainly enable for some funding and some support from the state level. The other one that we wanted to talk with you about that's a priority is allowing prescriptive authority for clinical nurse specialists. So as you know, they're an APRN, but it does not fall under the Board of Medicine. They only fall under the Board of Nursing. And because of that, they're unable to provide services to their full scope of practice. So there are certain barriers that they have then to providing patient access to care. So they would like to have joint licensure. So that would be under the Board of Nursing and the Board of Medicine. And that would give them prescriptive authority. And they still want to maintain a practice agreement with a collaboration agreement with physicians, but they do want the prescriptive authority and to be recognized under both boards. And actually, I think there's also going to be a study done, or that we're looking at having a study done in a subsequent year that would take a look at all of the APRNs and exactly where they need to be licensed and the benefits of this. But for now, this is where we would look at having them placed.
Yeah, and so this is already moving pretty quickly, you can see. So there is not a lot of opposition to this at all. You can see right down here in the bill history, this was passed on the 19th in a block vote in the House, meaning they really, didn't have a ton of discussion of it. It was agreed to. So it's already been moved over to the Senate. So it's voted out of the House, and then they have moved it to their Committee on Education and Health. So this is something we don't anticipate a lot of pushback on.
Oh, sorry. So peer-to-peer is something that we just recently added, but something that we've been working on for quite a while. The Virginia Nurses Foundation has been working on a number of mental health initiatives. We have a mental health roundtable. We have some funding through the Robert Wood Johnson Foundation for some mental health initiatives in the community, working with schools and doing some additional training for school nurses and school counselors, particularly dealing with youth. But we also recognize the need, and through both VNA and VNF and obviously ANA, we are trying to identify ways in which we can support nurses because we recognize the additional emotional, mental distress that this pandemic has caused. And it's not going to stop anytime soon. It's going to continue long after the pandemic has ended. So MSV, the Medical Society of Virginia, last year had gotten legislation passed that set up a very well-researched program that they developed with a third party called Safe Harbor. And this is to provide peer-to-peer support for physicians. And they have been developing that and getting that out and into the communities. And we are adding to that legislation to simply have nursing added to it so that we can now partner with the Medical Society to have this offered to nurses. And so it would come out looking as though it would come out under the Virginia Nurses Foundation. It would be a Nurses Foundation program, but it's in partnership with the Medical Society. The vetting and the research that they've done to develop this program is so impressive. So we are going to be so pleased to offer this. We're hoping that we'll be able to open this up in the next few months. Normally it takes a little longer for the governor to sign off on some things, but we're hoping that he'll sign off on this a little bit more quickly and we can get it into place. And of course, we are continuing to look at other things. This isn't the be-all, end-all that addresses every problem, but we are looking into other programs as well. And we're always happy to hear about other programs that you might suggest we consider looking into or promoting. And again, ANA also does the same. One nice thing to mention with this is that the peers who are coaching, and one of the things that this legislation does is provide some confidentiality. So for the individual who's participating, and also some liability for those who are offering the coaching or the support. The other nice thing to note is that the individuals on the support side providing the support are paid for this. So they're not volunteers, which means that there's more consistency in the program, more quality parameters in place. And again, we're really excited about it. You'll hear a lot more about it soon. And Kristen?
Yes, so we are going to move on in a minute to our virtual advocacy tools. But I wanted to say, if anyone has a specific question related to our public policy platform, I'll give you just a minute to go ahead and put it right in our chat feed. There were a couple that were asked that I was able to answer while Janet was talking, but if there's anything else you would like to ask, you can either send it to the chat, or if you would rather ask it privately, you can send it right to me. I'll give everybody just a minute, though, to ask any questions they might have. Okay, I got one here, and it is related to workers' compensation and how you would go about applying for that if you were sick and the presumption is passed. So, if you have COVID and there's a presumption for workers' comp, or there isn't, whenever there's a workers' compensation issue that you would go through your employer. So this doesn't set up a separate way for you to apply for it. It's the same thing. It's just the way that it is awarded or given is changed. So you don't have to go through the whole process of proving where you got COVID and getting documentation. And the assumption is if you are a nurse or another healthcare worker and your job role is treating and diagnosing COVID positive patients and you get COVID, then the presumption is that you got it at work.
And I think that just to add to that, Kristen, I do believe that there's a requirement in it for, this was part of the negotiated language, but it makes sense that there's a requirement in it that you have a positive test and that you've also required medical care, which is, I guess, signed off on, that you've required medical care. So if you're asymptomatic and have COVID, it's not really going to do anything for you. This is for people who are nurses who have genuinely had some serious illness as a result of this.
Right.
Burden of documentation beyond that there is none. So much different.
Yeah, and that helped us come to some agreement with some of the other associations involved, just because it removed the perception that anyone could just get COVID and say, oh, I need workers' compensation. Like you have to, like any workers' compensation, you have to really need it. It's not something you can get just because you are a little bit sick. So I got a question, a couple to answer, about anything being in the pipeline about nurse residencies, that there was a bill passed in Congress about expanding residencies, but only 24 states were involved. Janet, I know we don't have that on our radar this year.
No, we don't.
No.
So I'm sorry, I don't have anything that I can offer right now, but we can certainly look to it and follow up.
Yes, we can look into that. And I also would recommend checking out the American Nurses Association government and advocacy site, because if it's done at the federal level, they'll have all the information there and you can actually reach out to them and they can answer your questions. Allison, I see that you asked about loss of wages for quarantine time. I don't believe that it does. You actually have to have a positive test result and have to have sought medical care for COVID. So if you are just quarantining because of exposure, workers' comp would not cover it. Oh, after a positive test. Again, Janet, I think that you have to be positive, and then there's you have to have received treatment. I'm not 100% sure on the language change.
Yeah, we'd have to check on it. I don't want to venture a response on this without looking into some of the details a little bit more, but yeah.
But so if you get a positive test but you're not sick, I don't know if it covers quarantine, and that may be something you have to talk to your employer directly about once it passes.
It also may be the number of days that you're out of work.
Yeah. We did get a question about is workers' comp related to the Hazard Pay Act, and they're separate. And I know, I would assume the hazard pay we're talking about was the pay that was offered to, I think it was long-term care or LPNs. I can't remember the exact category, where the governor used some of the CARES funding for anyone that was treating, I believe it was Medicaid or Medicare patients in long-term care facilities, were subject to receiving a certain amount of funding from the state as a hazard payment. Workers' comp is completely different from that. So any hazard pay or bonus pay that comes from the state does not have any impact or have anything to do with any workers' compensation that we would be working on getting. So, all right. So we're going to move to the next part of today, but if you have more questions, you can put them in the chat. We're happy to answer them as they come up. We either will answer them in the chat or we'll answer them, we'll read them and ask them. Okay, so we're going to move on today to what we call the advocacy section. And we're going to cover a number of things. We're going to talk about why it's important to be an advocate for nursing, how you can do it effectively, and then I'm going to show you all the tools we have at VNA to make it really easy. But the first three things that I want you to all remember, if you go out of here, this event, and you forget everything, try to remember these three things. Number one is that there are more than 110,000 registered nurses in Virginia, and that does not count RN students. So the population is even bigger when we look at that. It's the largest population of healthcare workers, and that translates to about 1 in every 80 Virginians is a registered nurse. So that's a pretty big population of the state in terms of a workforce, and legislators love to know that information. They don't often realize that until someone who is a nurse tells them. And then for the 18th year in a row, nurses have been ranked by the public as the most honest and ethical profession. And I like to show everybody this chart. This is from the Gallup poll in 2018, but it looks pretty similar every year. The Gallup organization does this poll. They ask the public to rate the honesty and ethical standards of different professions. Nurses are at the top. And if you look way down here at the bottom, we have members of Congress and legislators. And personally, working with a lot of legislators, I don't really feel that they belong down at the bottom. The vast majority of them are honest and ethical and doing the right things for their constituents. But the reason that I like to show this chart is so that you all realize when you go into a legislator's meeting, when you send them an email, when you advocate for something, you're already walking in there being considered to be a very honest and ethical person, so they're going to listen to you. So remember that as we go through the rest of today. Okay, so we have a lot of different options for advocacy in a pandemic, and this presentation looks a lot different. Normally we're at the General Assembly. Ellie, our communications coordinator who's on the call, and I are standing outside lining everybody up to get ready to go through security. We're freezing. A lot of times it's raining or snowing. But this year we're all home and warm, and some of us are still in our pajamas, and so it's just a very different year. So we wanted to talk about the different things you can do during COVID. And so we're going to go through first our website at virginianurses.com. We have a ton of information we put all in the same place. We're going to talk briefly about how to effectively share things on social media. We're going to talk about email, how to use the phone, and then we're not going to recommend in-person meetings this year, but we have found out that I would say the majority of delegates and senators are meeting people via Zoom. So we're going to give you some suggestions on how to do that effectively. So the first place we're going to go is to virginianurses.com, and then you would navigate right here to the advocacy section and then click on 2021 Virginia General Assembly session. And Ellie, I will ask you to put this in the chat feed so everyone can copy it and save it. So what we have gathered here are all of the resources and materials that you need to find out what's going on with legislation and what you can do to help us. We kind of have our three big pieces of legislation that are going on right now listed here. If you scroll down just a little bit, we have a menu at the bottom where we have tried to gather everything, and this is available to everybody. You all should be able to access this. Right here, this is the policy platform we talked about. So this has got all the policy info we talked about today. And you also can download a PDF version and leave that with your legislators if you need it. And then we have our bill list. And this is a really good piece of info. We typically update this 2 or 3 times a week once we get the update, but we're waiting on the most recent one because so many things happened this week that we don't have the update yet. But this is a PDF. These are all hyperlinked. So if there was a bill you had a question about, I know someone was asking about House Bill 1737. So I'll just click on that. It takes you right to the legislative info page, and you can look at the progress of it. So the practice agreement legislation we were talking about has been assigned down here to a subcommittee in the House Health, Welfare, and Institutions Committee. And then if you really want to get into the weeds, and this is the thing that you're into, you can read the whole bill, but otherwise it gives you a nice summary here of what's going on and how it works. And then these are the impact statements we talked about. This is what a fiscal impact statement looks like. And I know some of you are in a policy class, so this might be something that is helpful and relevant to you. So the Department of Planning and Budget will put this together for different bills. And you can see down here that this bill would not have a fiscal impact on the Commonwealth, meaning it doesn't have to go to one of the money or budget committees to be discussed. And this has got a number of bills on here that we are supporting. So you can see we list here if this is legislation we support. And then there are some that we're not necessarily out there advocating for or waving the banner, but we are paying attention to because they either relate to nursing, relate to healthcare, relate to something that would impact your patient. So this is available to everyone. We update it as frequently as we can. And even if it's not updated, you can go in here and click on these links and learn more about what's going on. Then I know that this is definitely relevant to some of the students out there because I think for some of your classes you might have to watch a committee hearing. So we have compiled right here the list of all of the committee hearings in the live stream. So the cool thing about this year is that everything's being live streamed as it was in previous years, but a lot of your legislators in the House are on Zoom also. So you get to watch them, and then the Senate committee hearings are here as well. These are links to the House and Senate live stream when they're in session. You can watch and see them being streamed. This is a link to our legislation. These are the bills that we're really out there pushing. Each of our bills has a page where you can get facts, information. These are our talking points. So when we talk about reaching out to your legislators, the first question we get is, well, I don't know what to say. And don't worry about that. If this is legislation you're interested in promoting, we have done the work for you, and we can give you talking points, tell you what to say. There are downloadable PDF versions of this, and then also we've got some pretty cool shareable social media graphics that you can use on social media. So we'll talk about action alerts and emails in a second, but that's all there. We've got some other materials here you can take a look at. This is a tool we're going to talk about in just a second. This is our Action Center where you can sign up for action alerts. So if you are not already on this list, please go ahead and sign up, and we'll put this link in the chat feed as well. You can sign up for emails. We will email you when we need you to email or call your legislator, and I'm going to show you in a minute about how we have made that. I think I counted yesterday. It's 4 clicks from an email to sending an email received from us, taking an action and contacting your legislator. And then over here we have proposed legislation from other Virginia nursing organizations. So these are bills that VNA is not necessarily the one proposing it and working with a legislator, but they're bills that we support and information and fact sheets. So for example, the School Nurses Association, they are the ones working on this bill, and they sent us talking points to share. So that's all listed there. It's all in one place. You can come back as many times as you like and look at everything. And so before you get really deep into the weeds of doing advocacy work and doing outreach, you need to know who your legislators are. And so if you don't know who they are yet, there is a link. So you go into the Virginia General Assembly website, you type in your home address, or if you are registered, I believe if you're registered to vote at school, you would put your school address in here and let you know who you is a constituent of. And then it will give you all their contact info, which works really well. Hold on 1 second, I'm going the wrong way. The next question that we get a lot is, should I use social media? And we recommend this, especially as kind of a first step into advocacy. if you're not quite feeling up to emailing or calling a legislator, and you're definitely not ready to meet them because you haven't done this anymore, this is a great way to get started. But if you are going to use Facebook, Instagram, whatever social media apps that you're using, we recommend that you do it correctly. And by correctly, really what we mean is that you're sharing useful and fact-based information. And the best way to do that is to follow the organizations that are leading the legislative efforts of interest to you. So we're talking about the nursing organizations in Virginia, national nursing associations. I recommend following the Hospital Association, the Medical Society, because sometimes other organizations, they might put legislation out that you might oppose. And so it's good to follow all of them in your feeds and really look and see what information they're putting out there. I also strongly recommend that you follow your legislators, even if you don't agree with them, even if they post things that are not really something that you support. It's still important to know what they're saying. And you want to share the information that the nursing organizations are posting. So if VNA is posting information about legislation, you know for sure that we have fact-checked it, that we have evidence-based research behind it, that we've worked with legislators on it, that it really is correct information and good to share. So you can click the share button and share it with your friends. You can send it to people, but we only post things we know are based in facts and have the evidence to support it. So if you're sharing your own information, there we go. If you're sharing your own info, make sure you fact check, make sure you don't share anything that's not true. That is not helpful to any kind of advocacy. Make sure you're using hashtags, make sure you're providing facts, and share stories if you have them. The nursing stories we've been able to share for COVID workers' compensation have made a huge impact on getting that legislation where it's at. We've shared stories we've heard from nurses that are just like the one Janet shared earlier, and other ones where nurses get sick and that their families are financially impacted in a pretty severe way. So without nurses sharing those stories with us and sharing them on social media and through emails, we would not have been able, I think, to get quite as far as we have. So another great way to stay informed is to sign up for our action alerts. And VNA and the other nursing organizations, we all use advocacy software to make things easy for you to send an action alert. So what will happen is if you sign up for VNA action alerts, which we can put the link to do that in the chat feed, throughout session, when we need you to take an action, you're going to get an email that says, you know what, we need you to help us get workers' compensation passed. And it will have information, and we'll have an action alert button. You click it, you get taken to the page that you see on your screen right now. On the left side, you've got some information about the legislation and why it's important. Over here on the right, you've got your fields to fill out, and I will just put my information in there. And then you click the next button. And what this does is this matches you with your legislators through our software. We have already pre-written the email for you if you do not want to write anything yourself. So what you can, and I'm not going to click send because I've already sent this a couple times by mistake, so you only want to send it once. But you can edit the message, edit the subject. This is where we recommend, if you have a story, to go ahead and put your story in and tell it. And then the last thing you do is you click send. It goes right to your legislators. They get it. The important thing that we have here is that it says, I am a constituent. You only want to email your legislators, and you want to make sure they know you're a constituent. The only exception to this is sometimes VNA will ask everyone to email certain committee members, and we have nurses do that, but in bulk, because we want to get a lot of information out. But I would say 90% of the time, we're going to recommend you talk only to your specific legislators. And then the great thing about this is, on our end at VNA, we count how many go out, and we can see what messages are being sent. So this is how we get some of that really good information and stories and ideas about changing legislation. So please do these for us. If you sign up for our action alerts, we only use your information for legislation. We're not going to market other events to you. We're not going to send you information about VNA. It is strictly legislation, and it is strictly when we need you to take action. And Janet, I don't know if you're on the phone, but I think I would say that over the last 3 or 4 years, this has been one of the ways we've really gotten some traction on some different issues, specifically the nurse practitioner bill and our workers' comp bill in the special session.
It's been huge. It's been a remarkable benefit for advancing nursing's voice in the legislature. Just tremendous. So we really, if you ever wonder if it works, boy, this really does. So participate. And it's nice because it's strategic. You're not going to get bombarded with requests. It's very strategically planned so that you're getting a request when we know that it can make a difference.
And one of the things that we love to share is when we did the nurse practitioner full practice authority bill, I think we sent out 22,000 emails. And just in special session, just on workers' compensation, we sent, I think it was about 7,500 legislator contacts. And if you ask the legislator, they'll tell you if they hear from 10 people about a bill, that's a huge number. So the more you can help us do this, the more we can get our message out. And, I do sometimes get phone calls, and I've gotten them more, hey, can you please stop your action alert? They've gotten the point. You don't need to send it anymore. So the more of you that sign up and click that email button, the easier our job is and the better legislation we can get passed for nurses and nursing. Okay, so occasionally we are going to ask you to call your legislators, and we do that through our same action alert software. But we have a lot of nurses ask us, well, can I call and just tell them I support this? And we recommend that, especially during session when we have bills out there. But what I would recommend to you is that if you are going to call during the General Assembly session about something that we've talked about today, all you need to do is call and say, hi, I'm Kristen Jimison. I am Delegate McGuire's constituent, and I'm calling in support of House Bill 1985. Thank you. That's it. They don't really have time right now to talk, but they do count how many phone calls they get. And there are times where when we have a big bill going on, we will send a call script out to people, but that we typically stick to email during session. But we are never going to say no to you if you want to call and say, I really support this legislation. I'm your constituent. This is the House bill number. That's really it. You can call them outside of session and have longer conversations, but keep it short and sweet. Save yourself the time. I know everyone's busy. And that's a quick way to express support without having to do too much. So the next thing we're going to move on to, and I am going to wrap up here in about 5 or 6 minutes because there are some questions that I did want to address. Should you meet your legislator? And we say absolutely. We hope you all come next year to our lobby days, which hopefully will be in person, because we will take you over to meet your legislators and take you to the building. But in the interim, you certainly can call and meet them by Zoom. And some good reasons to do this is to establish a relationship. You will get to know your legislator on a much more personal level. You're going to help them understand your needs as a constituent, and you can serve as a nursing resource to them. And so I think I have a pretty good shot of someone knowing the answer to this question, but does anybody know how many nurses currently serve in the General Assembly? If you want to put that in the chat. We've had different success rates with asking that question, but if you know how many they are, go ahead and put it in the chat. If you know their names, you can put them in there. We've got 3 or 4, 3, 2, I would guess 2. So the answer is 2. We have 2 practicing RNs. We have Senator Jen Kiggins, and we have Delegate Dawn Adams. They are wonderful supporters of nursing and nursing legislation. But that's it. There's 138 other legislators who are not nurses, who the vast majority are not medical professionals. They don't work in healthcare. So if you're a nurse and you say, hey, I'm your constituent, I want to tell you about what nurses need, there's never been a better time than right now in the pandemic to get their attention. I can tell you that the best thing about being a nurse or working for VNA is when you call a legislator or you go into a meeting. And Janet and I, this happens to us all the time. We say, oh, we work for VNA. We're here with the Nurses Association. We always have to schedule a little bit of, a couple of minutes in the beginning, because the first thing we always hear is, I love nurses. My mom was a nurse. My sister's a nurse. And so you walking in there with that already established that nurses are wonderful and generally very highly respected. So they're going to take you very seriously. And then we'll send these slides out to everyone because there's a lot more information about how you schedule a meeting and what you need to provide them with. What I will say is if you're out there, and I know we've got students and we've got nurses, if you want to schedule a meeting with your legislator and you do that and you need help figuring out kind of what to say to them, I'm going to put right now my email address right here in the chat feed, and reach out to me. I'm happy to help you prep for a meeting. And I'm happy to help you get the information you need from our website if you can't find it. But a couple things if you are going to schedule a meeting. Typical meeting is 15 to 30 minutes. We're finding now in the virtual sessions, the Zooms that we're hearing from people doing are, they're 5 or 10 minutes. You might get to meet with a legislative aide. Don't be disappointed. The legislative aides are really the gatekeepers. They get information to the delegate or senator. They're a great person to know, and you might get more of their time. So, and then there's a lot of messaging information here that when we send the slides out, you can read through if you plan on scheduling a meeting. But we're guessing that the vast majority of things that people are doing this year are going to be social media, emailing, and calling. So if you're feeling brave or feeling really empowered and want to schedule a meeting and need help doing that, we're happy to help. So I'm going to, while I look to the questions, Janet, do you have anything that I missed you wanted to add about advocacy? And if you're, I can say, I know we have a lot of students out there. Once you graduate, consider joining your professional organization because we spend a lot of time trying to get legislation passed to help you in your profession because you don't have time to do that. Y'all are very busy, but we're here to do it.
Yeah, I think the big thing is just don't ever doubt the impact that your single voice can make because you're combining it with all other voices from throughout the Commonwealth. And we have such a strong constituency. Kristen mentioned the 1 in 80 number, that 1 in every 80 residents of Virginia is a registered nurse. That is a huge percent of, or a significant percent of each legislator's constituency. And that translates to leverage, and we need to use that leverage. So just remember, they have, most of them have full-time jobs outside of the legislature. They're people just like you and me. They need to be educated, and so they're really looking to you to help educate. Whether it's in the legislature or the public policy arena, you can really make a difference.
Yes, and I will say that we really cannot get these things passed and enacted without you, because Janet and I are not registered nurses. So we get to go into office and say, well, we're here supporting nurses, but when a nurse calls a legislator or a nursing student calls and says, hey, you know what, we need to talk about workers' compensation, we need to talk about staffing, we need to talk about healthcare worker mental health, it has a lot of power and a lot of impact. So please realize that you can do this. It's very easy. Don't be intimidated. Your legislators are people. And I don't think we've ever gone into a meeting and people have said, well, I don't want to talk to the nurses. They want to hear from you, especially right now. They want to thank you for the work you're doing. And a great thing to do is to take that gratitude and thanks and try to turn it into some action. So that's what we're doing at VNA, and I hope that you can help us with it. There are 2 questions. One is there a bill VNA works on regarding substance abuse, especially in relation to COVID-related mental health?
There is a, oh boy, and I looked through our bill list and I couldn't find it off the top right away. So I'll have to double check on it, but we are supporting the development of a task force that's dealing with mental health issues and substance abuse. And I can't remember if it's because I've had so many conversations really recently. Yesterday, I was having a conversation with somebody specific to maternal health, somebody from the state, and we were talking about this legislation. So I don't recall if it's specific to maternal health or if it's just mental health and substance abuse, but I'll look into it and we can make sure that that's on our bill list and that we're sharing information, unless Kristen, you're aware of it.
I'm not.
Okay, but we are supporting it. Make sure that that's included on the bill list.
Oh, here, Ellie put it in the sheet of the feed, House Bill 1913. So there you go.
Yeah, I'm not sure that's it, but we'll double check.
And then I had another question about, can you come to lobby days next year? Yes, absolutely. We hope by then everyone will be vaccinated. our lobby, we've already talked about we might wear masks anyway, because we always get the flu. But we're going to be there next year, and we are going to bring groups of people. We'll take you upstairs in the General Assembly building. We'll take you to committee hearings. We'll take you to the House floor. So yes, next year we are planning on being back in person, and we look forward to all of you joining us. Even if we always advertise the student groups every year as the practicing nurses, but I will tell you that I'm getting a lot of feedback, so I'm going to wrap up here. But I will tell you that we'll welcome you next year, even if you're not with your school or your group. Just look on our website, sign up. They usually open in late December because we get the schedule. But all of you, we'd love to see all 140 plus of you next year at one of our in-person lobby days. And you know, we'll be talking about, I'm sure, still COVID-related stuff next year, but we'll be moving on to some, hopefully, beyond the pandemic things. So that's all I really have. And we will follow up with an email with next steps and links to all the info that we showed you today. But I'd love to thank you all for joining us. Janet, thank you for all your help and your insight today. And thank you to Ellie, our communications coordinator. She's been handling all the technology stuff and posting links. And yes, this has been recorded. So if you have a fellow classmate or a nurse who doesn't or wasn't able to attend, we will post the recording. We have one more tomorrow morning, so it's still open. Send that to everybody you know, and let's get everybody out there talking about what we need to at the General Assembly. I'm going to say bye. I wave. I don't know if y'all noticed my dog is back there. He's been participating too. So hopefully next year we'll see you all in person. Stay safe, stay healthy, and have a great rest of your week.
Have a great day, everyone. Looking forward to seeing you next year in person.